STD stands for sexually transmitted disease, which refers to infections that are passed from one person to another during sexual activity. STDs can affect both men and women and can cause a range of symptoms and health problems. In women, STDs can cause symptoms such as abnormal vaginal discharge, pain or discomfort during sexual intercourse, pain or burning sensation while urinating, and itching, irritation, or soreness in the genital area. Some STDs can also lead to more serious health problems, such as pelvic inflammatory disease, infertility, and an increased risk of certain types of cancer. In this video, we will explore the STD symptoms in women, STD in women overview, causes, diagnosis, treatment options, and prevention tips. By the way, welcome to our channel. Don't forget to thumb up and subscribe. STD symptoms in women. Some common symptoms of STDs in women include pain or discomfort during sexual intercourse, abnormal vaginal discharge, pain or burning sensation while urinating, itching, irritation, or soreness in the genital area, unusual bleeding or spotting between periods or after sex, pain or cramping in the lower abdomen, bumps, sores, or warts on or around the genital area, fever, fatigue, or flu-like symptoms. It is important to note that some STDs may not show any symptoms at all, which is why regular testing is important for sexually active individuals. STD causes in women. STDs in women are caused by bacteria, viruses, parasites, and other microorganisms that are passed from one person to another during sexual activity. Some of the most common STDs that affect women include chlamydia, caused by the bacteria Chlamydia trachomatis, which can be passed through vaginal, anal, or oral sex. Gonorrhea, caused by the bacteria Neisseria gonorrhoeae, which can be passed through vaginal, anal, or oral sex. Human papillomavirus, a group of viruses that can be passed through skin-to-skin contact during sexual activity, and can cause genital warts and an increased risk of certain types of cancer. Herpes, caused by the herpes simplex virus, which can be passed through skin-to-skin contact during sexual activity, and can cause genital sores and blisters. Syphilis, caused by the bacteria Treponema pallidum, which can be passed through vaginal, anal, or oral sex. Trichomoniasis, caused by the parasite Trichomonas vaginalis, which can be passed through vaginal sex. So, who is at risk? All women are at risk of sexually transmitted diseases if they are sexually active and not taking measures to protect themselves. However, some groups of women may have a higher risk of contracting STDs than others. These groups may include young women. Women who are under the age of 25 are at a higher risk of STDs than older women, as they may be more likely to engage in risky sexual behavior and less likely to use protection. Sexually active women. Women who are sexually active, especially those who have multiple sexual partners, are at an increased risk of STDs. Women with a history of STDs. Women who have had an STD in the past are at a higher risk of contracting another STD. Pregnant women. Pregnant women can pass certain STDs, such as syphilis and HIV, to their unborn babies, which can have serious health consequences. Women with compromised immune systems. Women with weakened immune systems, such as those with HIV, AIDS, or those taking immunosuppressive drugs, may be at a higher risk of contracting STDs and experiencing complications. How to diagnose STDs in women. STDs can be diagnosed in women through a variety of methods. The specific diagnostic tests that may be used can depend on the type of STD suspected, as well as the woman's symptoms and sexual history. Some of the common methods used to diagnose STDs in women include physical exam. A healthcare provider may perform a physical exam to check for any visible signs of STDs, such as genital warts or sores. Pap smear. A pap smear is a test that is used to screen for cervical cancer, but it can also detect certain STDs, such as HPV, human papillomavirus. Urine test. Some STDs, such as chlamydia and gonorrhea, can be diagnosed through a urine test. Blood test. Some STDs, such as HIV and syphilis, can be diagnosed through a blood test. Swab test. A healthcare provider may take a swab sample from the cervix, vagina, or urethra to test for STDs such as chlamydia, gonorrhea, or herpes. It is important for women to get tested for STDs regularly, especially if they are sexually active or have multiple sexual partners. Getting tested can help to detect STDs early and prevent the spread of infection. Treatment options for STD in women. The treatment for sexually transmitted diseases in women depends on the specific type of infection, as well as the severity of the symptoms. Some common treatment options for STDs in women include antibiotics. Antibiotics are commonly used to treat bacterial infections such as chlamydia, gonorrhea, and syphilis. Antiviral medications. Antiviral medications can be used to treat viral infections such as herpes, HIV, and hepatitis B and C. Topical treatments. Topical treatments, such as creams or gels, may be prescribed for certain STDs, such as genital warts or yeast infections. Vaccinations. Vaccinations can help to prevent certain STDs, such as HPV and hepatitis B. It is important for women to follow their healthcare provider's instructions for treatment and to avoid sexual activity until the infection has been fully treated. Women should also inform their sexual partners about the infection and encourage them to get tested and treated as well. Regular testing and practicing safe sex can help to prevent the spread of STDs. Prevention tips for STDs in women. Preventing STDs is important for women to protect their sexual health. Here are some tips to help prevent STDs in women. Practice safe sex. Use a barrier method, such as a condom, during sexual activity to reduce the risk of STD transmission. This includes vaginal, anal, and oral sex. Limit sexual partners. The more sexual partners a woman has, the higher her risk of contracting an STD. Limiting the number of sexual partners can reduce the risk. Get tested. Regular testing for STDs can help to detect infections early and prevent the spread of infection. Vaccinations. Some STDs can be prevented with vaccines, such as HPV and hepatitis B. Communication. Talk openly with sexual partners about STDs and sexual health. Encourage partners to get tested and treated for STDs. Avoid sharing personal items. Sharing personal items such as towels, razors, or toothbrushes can increase the risk of STD transmission. Practice good hygiene. Maintaining good hygiene can help to reduce the risk of STDs. This includes washing hands regularly, keeping genital area clean and dry, and urinating after sex. By following these prevention tips, women can reduce their risk of contracting STDs and protect their sexual health. Thanks for watching. Take care and stay safe.